Hi! In this video, we're going to be talking about features of and how to use the Zoll R series monitor. You will learn when to use the Zoll in life-threatening situations including defibrillating, transcutaneous pacing, and synchronized cardioverting. First, you will need to make sure you have the leads and pads placed correctly. Let's look at how to put the leads and pads on the patient.
Go ahead and place these leads on your body, okay? You can expose your chest and pad.
You want to make sure that there is adequate conduction, so make sure the patient is dry.
Make sure you're dry.
And pay close attention to where you place the leads. The leads are placed at the right arm, and left leg. The pads are placed with a large cross mark on the center of the chest between the nipple line where you would perform CPR. The other pad goes on the left side of the back to sandwich the heart. Plug in the pads to the monitor if not already attached. The pads should always be attached to the monitor, even when not in use, to decrease time it takes to connect to patients in a real code situation. Now that we have our leads and pads on, let's talk about the monitor. Let's explore a few features of this monitor. One key feature of the R series Zoll monitor is the ability to filter the patient's rhythm from the compressions called see-through CPR. The other main aspect to the R series is voice-narrated CPR feedback. The monitor will tell you push harder or push faster to help with compressions. This monitor also has a better capability to monitor end-tidal CO2 to ensure that compressions are effective and to help determine when the patient has a return to spontaneous circulation. Turn the monitor on to monitor. The main display screen will show you the tracings of the rhythm, SpO2, NIBP, CO2, heart rate, and CPR index. The CPR index will tell you if you are performing compressions fast enough and deep enough. The rate and depth of the compressions are shown in purple on the monitor. The purple diamond will fill with color when compressions are deep enough and fast enough. You will need to make sure you are in the lead you would like to see in the rhythm. You can change the lead or place the monitor in the pad mode to detect the rhythm. Here is how you change the lead. Next, you can change the amplitude to determine exactly what rhythm you are in and help determine the difference between fine V-fib and asystole. Here is how you change the amplitude. Now, let's talk about defibrillating the patient. You will need to turn the monitor to defib. You will notice that everything you need is in the upper right corner in the red section. Once you have the monitor in the right mode, check how many joules you will be defibrillating with. Change the joules using the Energy Select button here in the upper right corner. Make sure everyone is clear and push the charge then shock button. Once you have defibrillated, you just need to change the joules. Hit the charge and then shock buttons with each new attempt to defibrillate the patient. That's how you use the Zoll for defib. Next, we will look at cardioversion. Now, let's talk about synchronized cardioversion. You will keep the monitor in the defib mode. However, the joules you will use will be less than with defibrillating. You will also need to know where the sync button is. First, change the joules to the amount you would like, usually starting at 75. Then hit the sync button. Once the sync button is hit, you will notice the arrows above each R wave. Hit the charge button. After making sure everyone is clear of the patient, hit shock. Next, change your joules to another amount. Hit the sync button again. You will need to hit the sync button with each new shock. Then the charge and shock buttons. Now you know how to use the Zoll R series monitor for synchronized cardioversion. Next is pacing. Now, let's talk about transcutaneous pacing. You will need to put the monitor into the pacer mode by turning the knob here. You will notice that everything you need is in the green section on the bottom right of the machine. First, look at the rate. Set the rate to whatever the physician has ordered, or keep at the default rate of 70 beats per minute. Next, look at the milliamps dial. This will determine the pacemaker output. You will turn the dial to the right to increase the milliamps until you get 100% capture of the rhythm. 100% capture means you will see a spike, then a wide QRS associated with each spike. Once you get 100% capture, then decrease the milliamps slowly until you lose 1 capture. Then increase the milliamps again until you get 100%. This is a stimulation threshold, and the lowest amount of milliamps you will need to pace the patient. However, you will want to set the milliamps at 10% higher than the stimulation threshold in order to ensure 100% pacing and capture. Typical thresholds range from 40 to 80 milliamps. That is how you use the Zoll monitor for defibrillating, synchronized cardioverting, and transcutaneous pacing. Thank you for watching.